on the record of the houses of the Oireachtas. I'd like to acknowledge the input from Fianna Fáil and Mary White. This is not a party political issue, but it certainly is a political issue, and we do need to make significant advances in the next 12 to 18 months.
Thank you, Senator Conley. Senator Jillian van Turnhout, you have 6 minutes.
Thank you very much, Cahirlach. And thank you, welcome Minister once again, and thank you to my the Labour senators for tabling this motion. And I think everybody here, and it's great to see harmony in the House, that everybody certainly recognises and welcomes initiatives and strategies in the areas of capacity legislation, dementia, Alzheimer's and positive ageing. And I'd like to use my time today maybe to move beyond the words that are here on paper and actually to maybe explore some ways that we can bring real life and make the issues that are before us tangible, because I think we can all say these words, but I think we all know the action speaks louder than words. So I suppose, firstly for me in relation to the National Dementia Strategy, I'd like to raise 2 points that maybe could be fed into it before it's published. Firstly, is that expert opinion is that earlier and accurate diagnosis is extremely important, as my colleagues have said before me, for the individual, but also for family members, due to such a diagnosis will deliver for them. And it's imperative that coming out of the implementation of the National Dementia Strategy, resources will be put in place or reconfigured that will result in a nationwide health service that provides timely diagnosis and the provision for early intervention supports and services. A crucial component to this will be access to uniform assessment of needs for both the patient and the carer. And my understanding is that the HSE is currently piloting a single assessment tool, and this tool will need to be such that it provides the necessary early indication of the possible onset of a dementia, and it also acts as an early detection mechanism which leads on to the necessary follow-up of intervention and support services. At present, the first port of call for most patients who present themselves to our health service with possible symptoms of dementia is at GP level. And making a diagnosis of dementia is not easy. And Irish research, and certainly also for me talking anecdotally to my local GP, is like their counterparts in other countries, they're reluctant to get involved in the area because of lack of confidence, lack of training, stigma difficulties, differentiating normal ageing from the signs and symptoms of dementia and resource issues. And there's a requirement, therefore, to ensure that all healthcare officials at GP, primary care or residential care levels are skilled in the detection and diagnosis of dementia and are suitably equipped with the necessary people skills to handle the delivery of the diagnosis to the patient and to their families. The second issue in relation to the strategy I'd like to raise is the community-based services. Following on from the early diagnosis of dementia and consistent with the Department of Health stated policy around shifting the emphasis of care back into community settings, there's a need to ensure that these settings are age and dementia friendly. Access to clinical dementia experts at local community levels will form the basis of key community services for those with dementia and their carers. People who need and receive community care, whether they're home health, respite, home care packages, hospice and palliative care services, they value these supports enormously. And however, the problem is access is discretionary, it's unequal and it's problematic. And the root of this issue is because I believe the lack of legislation to underpin access to these services. There's no statutory entitlement to home care and community care services. Since access is discretionary, it's extremely difficult for individual families and carers to get information and reliable access at critical points, for example, at discharge from hospital, the onset of disability, diagnosis of dementia, long-term or life-limiting illnesses. And I'd agree with the Ombudsman who observes, she said that people do not know where they stand in terms of their entitlements and in terms of the HSE's obligations to provide services. So I would support the call made by Older and Bolder for the inclusion as part of the National Dementia Strategy of the development of a long-promised legislation to establish a clear right to community care. And only this, I believe, would provide clarity and security to individuals and families. Minister, as I do stress that I welcome this motion and I do recognise the Government's achievements in this area, such as the publication of the National Carers Strategy in 2012, which I think was broadly welcomed by carers groups as an aspirational document that provides a solid basis for informing future policy decisions. But I also note the reaction from some groups I work with in areas in question like a motion like this, is nothing more than a series of platitudes unless it's accompanied by actions, such as recognition for the vital work by family carers. There's 50,000 carers who are responsible for Alzheimer's and dementia patients, and there's another 137,000 carers who are looking after other people with disabilities, spanning all age groups from children to elderly. And I think recognition of their work can be shown by the provision of adequate and ring-fenced resources, including payments to carers, which should not be seen as income supports, but as direct supports for their caring duties. And Minister, I know we're all very conscious we're approaching budget 2013, and the Minister for Social Protection, Joan Burton, recently gave us assurance that core benefits will be protected, but we still are wondering what are core benefits. For example, is the half-rate carers allowance a core benefit? And when we look at the funding sources for carers, there's the Department of Social Protection, who do benefits and allowances, Department of Environment do housing adoption grant, Department of Health Hospital do respite care. So when I look at it, I'm actually wondering, is it the citizen is at the centre, or is it the government at the centre, and the citizen has to be constantly running around, and we have to assess that citizen several times to decide what care they want to go through, and they have to go through the whole family history and story. So I do wonder if we can look, when we're bringing in, to reconfigure some of the resources, that we really are putting the patient at the carer at the centre and not wasting their resources. And finally, obviously, capacity legislation is mentioned, so I just would like to support that we need to do more. I'd advise the Minister to look at the document done by 15 stakeholder organisations on essential principles of the Irish legal capacity. But I do want to mention advanced care directives, Minister. They are legal in Ireland, but they don't enjoy statutory footing. I think it's extremely important that people in an already disempowered position, facing dementia or onset Alzheimer's, among the many capacity diminishing conditions, are not further disempowered by the uncertainty whether or not their wishes regarding their health care will be respected. I know the Minister for Health on the 8th of June, he gave an answer to basically say they're not on a statutory footing. So can we get clarification from the Department of Health and Department of Justice to work in coordination to ensure that a section on direct care directives will be inserted into the forthcoming capacity legislation. So in ending, I just would like to commend the Irish Hospice Foundation's Think Ahead community-based project, which is currently being piloted in Louth and Limerick, which is encouraging people to think about and discuss and record their preferences for future care. And I think it's an issue we have to talk about in Ireland, about advanced care directives. Thank you.
Senator van Turnhout. Senator Sean Barrett. Senator, you have 6 minutes.
And welcome, of course, again to the Minister. And I want to compliment the Labour and Fine Gael and, of course, the Taoiseach's nominee.